Hello, my name is Andres Triana, and today's lecture will be on Cri Du Chat. Symptoms and characteristics of Cri Du Chat include microcephaly, in which the subject has an abnormally small-shaped head. The deceased person also has mental retardation and learning disabilities. Other symptoms include a loud cat-like screech, hypertelorism, in which the deceased person has highly separated eyes, hypotonia, in which during infancy the person with the disease has extremely weak muscles and are born with an unhealthy low weight. Cri Du Chat occurs when a fragment of chromosome 5 is missing, hence why it is also referred to as 5p- syndrome. This leads to the loss of the CTNNDZ, a gene linked to a person's intellectual abilities. Although this is a genetic disorder, it is not inherited, but instead developed. It is not common in a specific prototype, age nor race, as only 0.005% of the world's population has it. Before the birth of the baby, an amniocentesis or CVS test can be performed to diagnose it, but can be fully diagnosed after birth with a blood test. Although a cure is non-existent, therapies do exist, such as speech therapy and physiotherapy. People with such a disorder experience slowed growth and other symptoms mentioned previously, which gets worse over a lifespan. Before the age of 2, a child with Cri Du Chat may experience the following: delayed milestones and failure to thrive, muscle weakness, poor mobility, gastric reflux, constipation, difficulty in feeding, and heart problems. After the age of 2, speech problems, hearing problems, vision problems, behavioral problems, orthopedic and emotional difficulties may become apparent. Growth rates also slow down throughout their childhood. The first person to identify the syndrome was geneticist Jérôme Lejeune, and let's see who will be the first person to cure it. Credits go to Cri Du Chat support group, which supports people with Cri Du Chat syndrome and their families.